Our second technique is to release the third cervical vertebrae. Embryologically, the third cervical vertebra serves as the fulcrum for the developing heart. The heart forms in the throat, basically, and as you get bigger, the heart migrates down, but it never forgets where its foundation is in embryonic development. That's why when people get scared or shocked, their heart, they say, can go up into their throat. I felt my heart in my throat. The heart forms on the midline, as does the third pair of somites. So we need to make contact with the posterior aspect of the heart and the posterior spinous process of C3, and then allow the heart and the third cervical to come back into the midline and to come back into relationship with each other. To get into the proper hand position, I've got a skeleton on the table here to show you. You're going to put one hand under the heart. So it's going to be between the scapulas, like so. And then middle finger on the third cervical spine, this process. So you'll be touching the spinous process, you'll be touching the heart, and nothing else if you can help it. Your focus is to make contact, settle, close your eyes, picture the space between your hands, the shape, the distance, and the tone or tension level, and then move your attention through the zones of attention. Try to see it from the different perspectives of in the body, around the body, from the room, and from the horizon. So we're going to go ahead, keep the camera rolling. I'm going to move over and do this technique on a real client. So we'll come into contact with the heart first. If you lift the shoulder, you can just slide your hand right under. It doesn't have to be on bare skin. It can be underneath the sheet. So it makes it sometimes easier to slide, especially if someone is set up for a massage. Middle finger comes underneath the neck, and you'll find with the index finger, C2, the biggest spinous process at the top, the middle finger can go to the one right below it, and then you've made contact. Take all pressure off, let the body settle into your hands, close your eyes, get a sense of your own midline, like we did before, but now when you're touching someone, find your shoulders, your neck, and your head, and their shape. And from this perspective, from your perception, notice the space between your hands, the shape, the distance between your hands, and the tone. Do the heart and the third cervical feel to you like they're on the center, obeying the midline. If not, don't try to move anything, just observe, notice that shape between your hands. And notice as you're holding the body that it can change. Follow any changes that present. If your hands seem to come away from each other, follow that. If your hands seem to be shaping, geometric shape, or some other kind of shape, observe and maybe even acknowledge that for your client. If you feel the tone change, which often happens, and go from tense to more settled, let it settle right into you. Move your attention now with your eyes closed through the zones. Find zone A, your own fluid body, not theirs, and become more buoyant. Let go of your insistence of finding and evaluating and treating structure, and find this embryological pattern for health. Heart on the midline, intimately connected to its C3 fulcrum without any stress whatsoever. Can you feel your own heart beating in your chest? Can you sense its connection to your neck? Can you look from your own zone A perspective at your hands, the space between, the shape, the distance, and the tone. Can you bring your attention out into your own field? Notice your Zone B field is close enough and perhaps interacting with the Zone B field of your client. Can you sit still and notice the connection occurring? And from Zone B, can you look at space between your hands, the distance your hands are away from you, the shape, the distance, and the tone. The body on the table can change size. It can get smaller, like this one, or bigger. As you move your attention into energy fields and frequencies, letting go of structural scrutiny. Acknowledge the changes as you move your attention out to Zone C, the room. I would keep your eyes closed. Find the four walls around you. The container having a ceiling above and a floor below. Can you sense the container all around you? And you see the size of the room. And as you move out into the room, you're expanding the space, letting go of scrutiny. Is there any change between your hands and the shape, the distance, and the tone? And settle. As you move your attention beyond the room, out into the natural order, you might visualize a place in the natural world where you felt calm and settled. Or you might visualize yourself looking out over the ocean at the horizon. The horizon where the ocean and sky meet is perfectly still. And from the far environment, from infinite space, can you look back and look at your hands and the space in between and notice any changes in the shape, the distance, and the tone? It oftentimes expands and feels like it gets less compressed, bigger, less stressed. As you bring your attention back through the zones, continuing to monitor, acknowledge changes in each zone of awareness. The autonomic nervous systems of you and your client connect and create these changes upon observation. Once changes are felt, you can acknowledge them and come out from under the body. I would take my palpation window of the C3 out first. Just remove that gently. Lift the shoulder so you can take the other hand out without disturbing. And then ask your client, what changed? And we'll move on now to step 3.